Today I'll be demonstrating a head-to-toe physical assessment on my stuffed animal for my N190 class. I already tested my client's distance vision using the Snellen chart. Client tested 20 out of 20 uncorrected. Client was able to read all the letters on the 2020 line except for the line below. I did his vital signs as well. His temperature was 97 degrees Fahrenheit, pulse was 60 beats per minute, respiratory rate was 18 breaths per minute, and the blood pressure was tested on the right arm while he was sitting down 120/80 millimeters of mercury. Hi, my name is Shauna. I'll be your nurse today. Before we start the assessment, I'll ask you a couple questions. Please tell me your name and date of birth. Do you have any allergies, like to food, medications, or an environment like pollen? No allergies. Okay, and then are you in any pain at the moment? No pain. Please tell me where we are. Please tell me the name of our current president. Please describe to me how you're feeling today. Oh, you're happy? Do you feel happy every day? The next couple questions I'll be asking will be in regards to your bowel and bladder. Please describe the color and consistency of your stool. Is it soft, hard, loose? And how many times a day do you move your bowels? Do you have any difficulty urinating? Please describe the color of your urine. Does it have an odor? Do you have a burning sensation upon urination? And how many times a day do you move your bowels? I'm going to hand sanitize and grab my pen light. I'm going to assess the client's ears, eyes, and mouth. Looking at the ear canal and the outer ear, the ear canal is pink, no swelling, no drainage, slight cerumen. Client will turn to the left. Ear canal is pink, no swelling, no drainage, and slight cerumen. We're going to do some eye tests. Direct, concentric, direct, and concentric. Next, we're going to do the 6 cardinal field of gaze. The pen light is 12 inches away from the client. I would like you to please focus on the pen light and the direction of the pen light and only move your eyes and not your head. I'll advance the pen light forward to test for accommodation. Thank you. Next, I'll be examining your mouth, so please open your mouth wide for me. Oral mucosa is pink, teeth are white, no cavities. Say ah so I can see your tonsils. Tonsils are grade 2. Please lift your tongue up for me. Frenulum is midline. Next, I'm going to check the client's JVD. The JVD is a 45-degree angle on the sternocleidomastoid muscle. Up and down, no JVD. 45-degree angle again, up and down, no JVD. I'm going to put the pen light down and do some hand hygiene, and we're going to do some cranial nerves. Can you smile for me? Can you puff your cheeks? And can you stick your tongue out to the left and now to the right? And hand hygiene, and is it okay if I assess your lymph nodes? Use 2 finger pads, slow circles. Preauricular, postauricular, occipital, retropharyngeal, submandibular, submental. Hook your fingers for supraclavicular. Below the clavicle, you can test for skin turgor. Client has no tenting. I'm going to put my hands on the client's shoulders. Please shrug your shoulders. Symmetrical. I'm going to flip my hands dorsal for the client's temperature. Please let me know if you have any pain or tenderness. Client is warm. 2 finger pads to test for edema. All the way to the fingers. Client has no edema. I'm going to test for cap refill. and use my finger as an example. Less than 3 seconds. Less than 3 seconds. If client were to have any nail polish, we can take off one nail polish on the finger and assess for cap refill, or document and say unable to do cap refill due to nail polish. Can you please squeeze my hands? Okay, good muscle strength. The skin tone of the client is tan with pink tones. Client has no masses, no lesions. And we're going to do some joint range of motion. So can you extend your arms and touch your shoulders, then extend. Thank you. Now please raise your hands above your head at 180 degrees. Now we're going to test for some reflexes. I'm going to hand sanitize and clean the reflex hammer. For the biceps, client will bend the elbow. My thumb is on the antecubital. Forearm flexion. Bend the elbow. Thumb is on the antecubital. Forearm flexion. For triceps, it should be above the client's elbow. Forearm extension. Above the elbow, the Lacronan process. Forearm extension. For brachioradialis, we're using the long side. Client's palm will semi-pronate 3 inches above the wrist. Supination. Supination. And I'm going to test for the client's patellar reflex. I'll ask the client, do you have any knee injuries or knee surgeries? Client declines both. I'm going to dangle the client's legs. Then you go inferior of the patella. Lower leg extension. Lower leg extension. I'm going to hand sanitize and get my stethoscope to auscultate the client's carotid arteries. The carotid arteries is between the trachea and the SCM muscle. And I'll be using the bell of the stethoscope. Please hold your breath. Please hold your breath. Okay. Client has no bruise. I'm gonna put the stethoscope down and now palpate. Hand sanitize. One at a time, the carotid arteries. I'm gonna hand sanitize one more time, get my stethoscope, and auscultate the heart sounds. Aortic, second intercostal space, right sternal border, S2 is louder. Pulmonic, second intercostal space, left sternal border, S2 is louder. Erb's point, third intercostal space, left sternal border, S1 is equal to S2. Tricuspid, fourth intercostal space, left sternal border, S1 is louder. Mitral, fifth intercostal space, left midclavicular line, S1 is louder. Client will be leaning forward for the apical pulse, listening to the heart rate for 60 seconds. Client's heart rate was 63 beats per minute. I'm next going to auscultate the client's lung sounds. So please take a breath each time you feel my stethoscope on your chest. Raise the right arm 4 to 6 intercostal space, right middle lobe, right mid-axillary line. We're now going to auscultate the client's lung sounds in the back. Avoid the scapula. I'm going to put the stethoscope down, wash my hands, and do the respiratory expansion. Lower rib cage T10. Please take a deep breath. Client's respiratory pattern is even and unlabored. Next, we're going to do the abdomen. We're going to assess the client's abdomen. Client's umbilicus is midline, no lesions, no masses, and no bruises. We are now going to be eye level the client's abdomen to observe for the contour and pulsations. Client has no pulsations and the abdomen is slightly rounded. I'm going to hand hygiene, use the diaphragm of my stethoscope to auscultate all 4 quadrants of the client's abdomen. 15 seconds, 15 seconds, 15 seconds, 15 seconds. Active bowel sounds, 18 gurgles per minute. I'm going to switch to the bell to listen for bruits left of midline. Client has no bruits. I'm going to put the stethoscope away, hand hygiene, and percuss in all 4 quadrants. Tympanic in all 4 quadrants. And please let me know if you have any pain or tenderness and I lightly palpate your abdomen, 1 to 2 centimeters in depth. Client states no pain or tenderness. I'm going to use the dorsal surface to assess for temperature of the client's lower extremities and then testing for edema and all bony prominences. Client has no edema. Testing for cap refill, less than 3 seconds. Less than 3 seconds. Popliteal pulses behind the knee. It's good to check if they're symmetrical to see if there are any circulatory problems. Dorsalis pedis, halfway between the ankle and the toe, and between the great toe and the first toe. Checking for symmetry. Pulses are symmetrical. Please push against my hands. Please pull against my hands. Good muscle strength. Please bend your knee to your chest. Please wiggle your ankle. Thank you. Now we're going to assess for cranial nerves. We're now going to assess the client's cranial nerves. I'm going to hand sanitize to assess for the trapezius muscle. My hands will be on the client's shoulders. I put pressure, try to shrug your shoulders and try to resist. And to also assess for the client's trapezius muscle, we're going to have the client look left and look to the right. Okay, thank you. And next, we are going to do the rapid alternating action, hands on your lap, and alternate them back and forth. Okay, thank you. And now we're going to do the cerebellar heel to shin. Bring your right ankle and bring it down to your shin. And you can also close your eyes. And do it to the same. Bring it to your knee and down your shin. Okay? Next, we're going to do the gait and balance. I'll have the client please walk 5 steps forward and walk 5 steps back, heel to toe to me, please. Thank you. Now we're going to do the whisper test. For the whisper test, I'm going to stand 1 to 2 feet away from the client. Client's one ear will be covered, and I'll whisper. And please repeat what I say. Client will cover the other ear. And again, please repeat what I say. Okay. Now we're going to do the Romberg. For this assessment, the Romberg consists of your hands and feet together by their side. The client will close their eyes for 20 to 30 seconds, and I will monitor their sway. Client has no sway. I'm now going to do the smell test. For the smell test, client will cover one nostril. So please cover your left nostril and tell me what you smell. Peppermint. Yes, correct. And again, cover your right nostril and tell me what you smell. Lavender. Correct. And that concludes my assessment with a stuffed animal. Thank you.